Earlier this month, I told you about Dr. Brian Day and his ongoing court case in BC, where he is challenging the BC Medicare Protection Act. We are the only OECD nation to give the government a monopoly on providing universal health care. Sadly, that has resulted in numerous cases where patients have deteriorated or died while waiting for treatment within the public system because they are not permitted to seek out private care within the country. So Dr. Day and his privately run Cambie Surgery Center are challenging this government monopoly on providing universal health care. This week is an off week in the trial, so I was able to sit down with Dr. Day and discuss his case and why he wants to see private clinics in BC and across our country.
It's about putting into law for the rest of the country what the Supreme Court of Canada ordered in the Quebec case in 2005, which was that if government promises you treatment and care in a reasonable time and then doesn't deliver you that treatment in a time that you need it, are you entitled under the charter to use private insurance to pay for that? And right now in most provinces that's not the case.
In my previous report, I pointed to a study published on longwoods.com that showed that when people are injured on the job and WCB is able to cover your injury treatment, that people are able to get back to work 26 days sooner on average. Well, that's what's allowed Dr. Day's clinic to continue to operate in this gray area. But as Dr. Day told me, his clinic has also treated hundreds of patients on compassionate grounds.
I mean, over the course of years that our clinic's been operating, we started in 1996. We've actually treated almost 500 patients at significantly reduced or no cost on compassionate grounds. Of course, we're a privately funded clinic. We need to pay our staff and pay our nurses, so there's a limit to how much we can do there. But one of the biggest groups of patients we treat are injured workers, and that's done under the auspices of workers' compensation boards. And the rationale there, of course, is that if you're an injured worker and you're costing the workers' compensation board, say, $4,000 or $5,000 a month in wage loss benefits, then for a $3,000 or $4,000 operation and getting you back to work in a month, it not only makes sense economically, it's also the worker not subjected to pain and suffering. And the Supreme Court of Canada ruled in 2005 that Canadians were suffering and dying on wait lists. We're the only rich country where that happens in the world.
Isn't that disturbing? Canadians seem so obsessed with government-run healthcare that even having our own citizens die while waiting for treatment isn't enough to convince groups like the Canadian Centre for Policy Alternatives or the Broadband Institute, who constantly obsess over the moral superiority of 100% government-provided universal healthcare. I asked Dr. Day about the criticisms leveled at him and his case from these groups and the protesters who've been outside the courthouse during the proceedings.
Well, I don't think they believe what they're saying, for one. As I said, the commonest demographic of a patient we treat is a unionized injured worker who's off the job. And these are working class patients who would otherwise be waiting a year or so. Secondly, these groups are funded by public sector unions. The public sector unions seem to be quite happy for patients to wait and suffer and die on wait lists. I think most of the population of Canada is not in agreement with that philosophy. There was a poll of doctors, across Canada poll, that showed that 57% of doctors have had patients suffer and significantly deteriorate while on wait lists, and a quarter of the doctors surveyed had a patient die on a wait list. So this is just a month ago. The federal health minister was at the Canadian Medical Association meeting here in Vancouver, and she pointed out in a recent review by a group called the Commonwealth Fund that we were ranked 10th out of 11 in developed countries. The only country ranked worse than us was the United States, but we were ranked near the top in what we spend. And there's something wrong with that picture, that we're spending a lot and being ranked near the bottom. Ranked near the bottom for access, ranked near the bottom, funnily enough, or strangely enough, for patients who are in the lower socioeconomic classes. And ranked bottom in equity, which are the very things that our system was supposed to provide.
He's right, public sector unions like the BC Nurses Union have been the biggest opponents of private clinics and Dr. Day's court challenge. In fact, they are intervening in the case, and Gail Dutel, the president of the BC Nurses Union, said, quote, "This is about public healthcare, the jewel of Canada's healthcare system. It is a core value of our society, and we have to defend it." Have to defend it, eh? Does that come despite what you know and the fact that Canada ranks 10 out of 11 countries and that Canadians are dying and suffering while waiting for treatment all because your union is afraid of allowing private clinics that may not employ members of your union? Well, as if we needed any more evidence that public sector unions are in it for their members and their members alone. Absolutely no compassion for those who may be desperate and want to look outside our chronically underfunded and inadequate public system. Especially since we heard that statistics show this impacts the poor the most. Dr. Day and I wrapped our discussion by talking about what kind of system the Canadian healthcare system could model after if his case is successful.
A hybrid system, yes. There are various models, German, Swiss, and so on. I think one of the other myths out there is the fact that doctors might prefer the private sector. Well, the reality is doctors are not being allowed to operate in the public sector in Canada, and the public sector is operating as a monopoly. The biggest wait lists in Canada are in my area of orthopedic surgery, and yet there are recently graduated 178 young orthopedic surgeons in Canada, fully trained, who cannot get a job because the hospitals won't give them operating room time. That group need to be brought into the workforce. The way you bring them into the workforce is by expanding capacity, and the government has not expanded capacity. It has no funds to expand capacity. And we see in Germany, this isn't about jumping a queue. We see it in Switzerland. We see it in Holland, that there is no queue in the public system in those countries, yet they have a hybrid public-private hybrid operating. So we know from experience around the world that having a little bit of competition improves the public system. Well, I don't know of a single monopoly that serves consumers well, not in any field. And I think the other thing that your viewers should realize, because a lot of people don't realize this, we're the only country on earth. I mean, I include all the communist countries like China and Laos and Vietnam and Cuba and North Korea. We're the only country on earth that says it's illegal to buy insurance for yourself. And you don't necessarily have to buy that insurance. 70% of the public of workers have disability insurance through their work. If you're injured at work, you're covered by workers' comp. But if you're injured off the job, the disability insurers are not allowed to do what workers' comp does. And one of the classic patients I have was a phys ed teacher who tore his knee ligaments in one knee at work playing soccer with his grade 12 students. He got his MRI in a week and his surgery within weeks and was back at work in 4 months. He then tore his other knee ligament playing soccer with his rec team on the weekend and was waiting 1.5 years, being paid disability insurance, but not able to use, the insurer was not allowed to use that because such insurance is banned in Canada. This doesn't make any economic or medical sense.
If that last example that Dr. Day gave about the phys ed teacher doesn't typify exactly what the problems are in our government-run monopoly on healthcare, then I'm not sure what will. This case is going to be ongoing until February. I'll keep you updated. And for the sake of all Canadians waiting for care, let's hope Dr. Day is successful. For the Rebel.media, I'm Christopher Wilson. Hey, did you like what you just saw? Well, check out my latest campaign at badidea.ca and tell Mayor Robertson to end his ban on natural gas.